for all of you out there who are like me and have never heard this word before, diascopy means smushing a red area to see if it gets white or not when you smush it. This is the actual scientific word for it. So now that you know that, we can talk about this article, which is employing that technique to diagnose what's causing erythema in your patient. But that was the first thing I learned from this article. Is a brand new word.
I knew what diascopy was. I have been taught this technique, and I don't know why I don't use it more frequently. I mean, there's slides right there. It's cheap. It's fairly easy to do. And, the article actually does go into this a little bit, that it is a subjective test, like some other tests. You're relying on yourself to say, okay, did the skin turn white or did it not? The thing that this brought back to me, though, was, so if the skin turns white, that's a positive test, but that generally means it's not caused by hemorrhage or leaking. And I'm just like, I need a flow chart again to go through like exactly what positive and negative means when interpreting this test.
I think a nice aspect of this test is you can use it to show clients why you may want to do a biopsy, right? So it's not a perfect test, but it's essentially a zero risk test. You're not going to hurt anything by doing it. And it's obvious to the client. You can show them, blanching of red skin that does blanch, and then show them the difference between a non-blanching lesion and explain, a lot of these lesions are ones that we need to do a biopsy to diagnose and can be really important to get an exact diagnosis on this condition. So I like tests that can show the client an instant, clear results and explain kind of the logic behind your recommendations.